Good afternoon. This is officially the worst slot of today because everybody's had a bit of lunch, had lots of brain stuff, so I'm guessing you're all feeling a bit sleepy and a bit dopey. So I'm going to try and keep this a little bit interactive. So if I ask you questions, you have to interact. Is that okay?
Yes.
Oh, God. Okay. Not what I was expecting. Okay, right. What I've been interested in as a researcher is how we get people with mental health problems to be better at sticking with their pills. I'm interested in adherence. And those of you here who are healthcare professionals kind of probably quite like enjoying wagging your finger and telling off patients when they don't do what is good for them. Would you agree with me?
Yes.
No. It's always one. But I kind of want to turn that on its head. And this is, I guess, the point that I'd like to make. I'd like to turn that on its head. I don't want to talk about patient adherence. What I want to talk about is professional adherence. What I want to talk about is being faithful to treatments. So this is a quick quiz question. What do these three gentlemen have in common? I was then going to say, what do they have in common with most mental health professionals? Then I thought that was a bad idea. This is all just trying to get a point across. So each of these gentlemen have a little bit of a problem, some more so than others, about being faithful. So this is the focus of my talk, about the importance of being faithful. This is not thought for the day, by the way. So what we have in mental health is we have complex interventions. It's been slightly anxiety-provoking this morning, hearing people talk about clever technology and things that really just beyond me. I don't understand it. Because for me, mental health is about sitting down with a patient and talking to them. And I think actually that's still in very much the essence of good healthcare. It's about sitting down and talking with patients. So when it comes to dementia, one of the things that can be very helpful and very effective is to sit down and talk with them about the past. And that's a therapy that's called reminiscence. And there's fairly good evidence from a number of randomized controlled trials that this is a helpful intervention to do. But what you've got to do is mental health professionals like me have then got to go into practice. And with the patients that I work with, I have to then deliver that intervention faithfully. And one of my PhD students has just completed a study. This is a randomized controlled trial about getting reminiscence into care homes. So training care workers in care homes to deliver reminiscence therapy. And what she observed was that if patients got reminiscence therapy, they benefited. But most patients didn't get reminiscence therapy. There was widespread infidelity amongst the clinicians working in the care home delivering that intervention. So my worry, if you like, is that we go from efficacy. We spend a lot of money doing well-designed, randomized controlled trials, proving that treatments work, and then that translates to ineffectiveness, to treatments that don't work in day-to-day routine clinical practice. And this is an example from my own work. The sad and unfortunate guy on the bottom of the screen is me having finished a half marathon. I hope you're very impressed. I kind of believe that exercise is a solution to all the world's problems, and if everybody exercised more, we would all be a much healthier nation. And we were looking to see whether we could get people with severe mental illness to exercise more. And there's, again, some very nice efficacy studies that show that if you can get people with severe mental illness to exercise, you improve their physical well-being. So we tried to roll this out in a real-world clinical situation that was called Kent. And that wasn't a joke. So we rolled this out in Kent, and what we found was that about only 20% of patients actually got the intervention, and 80% didn't. And again, we made that same observation that if people got the intervention, they got the benefit, but most people didn't get the intervention. So the consequences of infidelity, and Boris really needs to pay attention to this, are wasted money, wasted time, and poorer health. So why are mental health professionals unfaithful? There's a couple of studies that have come out recently that really seem to show, to emphasize this point, that if we don't believe in a treatment, we won't stick with that treatment. And there was a study just published recently about how we work with people in mental health crisis, and it made this point very eloquently. If we don't believe in it, we don't deliver it. One of the other great barriers, and I think this is always an interesting debating point, is that whenever you teach a clinician about a new intervention, what they will say to you is that I don't have enough time to deliver that intervention. So time is always perceived as being a barrier. And then the third point would be you teach people a clinical intervention that you've spent several £million developing and testing in a randomized controlled trial, and then they will go, well, do you know, actually, I think I need to change that a little bit. And if you change an intervention, chances are it won't work. So these are my, I guess, 4 tips about how we can promote fidelity. I think we need to ensure that the quality of our teaching means that clinicians, when we've taught them, are able to deliver, they are competent to deliver the treatments that we've taught them. Once we've taught them, we then need to check. These are weighing scales. This is about calibration. This is about checking that people are delivering the interventions, delivering the treatments in the way that they should. And I guess I kind of quite like monitoring and auditing and looking at what's going on in practice to make sure that we are delivering the best treatments that we possibly can. So that's me done. My message to you, if you like, is that what we need to do is we need to promote fidelity. If we promote fidelity, we can improve the health of people with mental health problems, specifically people with dementia. The end.
Thank you.